So I just wanted to provide an update to this case that we had talked about last time on a video where we have this patient presenting with these ulcerative necrotic lesions on the trunk and upper extremities as well as acral surfaces. Biopsy had showed pseudoepitheliomatous hyperplasia with neutrophils, which entertains a diagnosis of infection typically, as well as pemphigus vegetations and halogenoderma. So since the last video, I had the patient get some labs, which were negative for desmogleins 1 and 3, ruling out pemphigus vegitans, negative for iodine and bromine, ruling out halogenoderma, as well as negative for histoplasma blastomyces and coccidioides, making infection unlikely. Also, I had sent out for universal PCR, which just came back as negative, making again infection unlikely. So where does that leave us? So this patient has a history of an indolent leukemia that typically doesn't present with cutaneous findings. However, TCR by PCR from the most recent skin biopsy showed a clone that had previously been identified in this patient. So the possibility is that the blood clone or blood leukemia has manifested in the skin, although this would be unlikely because the subtype of leukemia that the patient has rarely does that. Plus, the patient was on therapy directed towards that leukemia without any resolution in the skin findings, so that would be less favored as well. So thinking through it again, halogenoderma ruled out, pemphigus vegitans ruled out. We're not left with much. Infection remains a possibility. I'd set the universal PCR on formalin fixed skin, which lowers the sensitivity. So I think my next steps are to repeat a biopsy on fresh skin for universal PCR and culture to see if anything pops, and work with our dermatopathologist here to try to run some more immunohistochemical studies to see if this is some type of weird cutaneous T cell lymphoma, although there wasn't a real weird or atypical clonal population of T cells that was seen within the skin. So that's all to say. We've ruled some stuff out. Need to try to figure this out more. This is a very difficult case, and trying to figure it out. We'll keep you posted and see where we go from there.